March is Colorectal Cancer Awareness Month, and HealthLink is doubling down on our coverage as studies show more younger people are getting diagnosed with the disease. At the same time, a potential breakthrough in fighting this type of cancer. Researchers at the University of Washington's Cancer Vaccine Institute are developing a vaccine that could prevent and target colon cancer. For researchers on a mission to develop cancer vaccines, part of the goal is to stop cancer from taking hold in the first place.
A large part of our work, I'd say more than 50%, is developing vaccines to prevent cancer. And one of the major ones we're working on is preventing colon cancer.
Dr. Nora Desis, known as the mother of cancer vaccines, is the director of the Cancer Vaccine Institute at the University of Washington and a member of the Fred Hutch Cancer Research Center. Desis and her team have for years pioneered the use of immunotherapy to target cancer cells. The center has already made advancements in developing a vaccine to fight breast, ovarian, and lung cancer. But how? In the same way vaccines target pathogens to combat infection, cancer vaccines are designed to target cancer cells. Desis breaks it down into three key components: an antigen, an immune stimulant, and a delivery vehicle. And for the colon cancer vaccine, that delivery vehicle is DNA.
Over the last decade, all these technologies have come together to allow us to get to the point now where we can move from the laboratory into the clinic with safe and effective vaccines that can really be tailor-made for almost any type of cancer.
A significant focus of cancer vaccines is prevention.
And it was during a routine screening, so I did not have any symptoms.
Seattle resident Becky Brune has for years turned to the traditional way to screen for colon cancer. She was 64, she's now 65, when a colonoscopy found a polyp that didn't cause alarm at first.
I had no reason actually to think that this was going to be anything other than a regular colonoscopy.
But doctors called her back weeks later to say it was indeed cancerous. She had colon cancer.
I probably was a little in shock and a little numb as far as like what this was going to mean. It felt very silent. I had not been able, I live alone. I had not been able to communicate with anybody about it yet because I didn't really know what it was yet.
Brune had her first colonoscopy since turning 50 and had polyps removed before. But only now did one turn out cancerous.
This is one of the reasons I've been talking about it with my friends and family so much, is because the screening, I know it's so easy to skip screening for cancer, especially if you don't really, it doesn't run in your family. And why do it?
The colon cancer vaccine that Dr. Desis and her team are working on would target polyps before they ever become cancer.
And that vaccine would train your immune system that when those polyps started coming up again after they were removed, your immune system now would intercept those polyps and get rid of them before even your next colonoscopy. That would be the goal.
A potentially remarkable breakthrough that Brune supports.
And we point our medical research at these problems and solve them. And I don't know, it makes me very happy.
Dr. Desis says this vaccine is still undergoing research. She hopes it will get into a clinical trial by 2027. For HealthLink, I'm Christine Pay.